Okay, well, let's get started. My name is Amanda Shipley, and I'm the owner of Renew Pelvic Health, and I'm very pleased to be introducing both of the speakers today. So, Ariel Esperancilla is a pelvic floor physical therapist and has a doctorate of physical therapy degree from Emory University School of Medicine and a BA in exercise and sports science and global studies from the University of North Carolina, Chapel Hill. Ariel has advanced training in pelvic health through the Herman and Wallace Pelvic Health Rehabilitation Institute and is certified in dry needling. She sees patients here at Renew Pelvic Health and is passionate about providing a safe space for inclusive and empowering care. She assists patients in navigating their healing process and normalizing care of their bodies by providing education and destigmatizing pelvic health issues to ensure that you get the support you need without suffering in silence, shame, or isolation. Ariel's visits incorporate a functional approach to rehabilitation and prioritize a holistic strategy for pelvic health and orthopedic conditions to promote resilience and independence with your overall health and wellness. Ariel uses a wide variety of manual therapy techniques, dry needling, patient education, and individualized therapeutic home programs to help patients reach their goals. Thank you so much, Ariel. I'll let her take away.
Thank you. So, as Amanda said, my name is Ariel. I'm a physical therapist here, and I work closely with Dr. Amanda Shipley, the owner. And we're really excited to have you all here today in this talk. And I'm really honored to speak along with Dr. Erika Pluhar, who is the co-owner and therapist at Whole Heart Psychotherapy, along with her amazing team of providers, and to be able to share this information with you guys. So, thank you for joining us. All right, so diving right into this topic, especially when it comes to your pelvic health, there is such shame and taboo placed on this area of your body by society that there's a lot of misinformation or flat out lack of information. One thing we like to point out is how many words do we have for your knee or your shoulder or your elbow? We have one. But we could be here all day talking about different slang terms and code words for your genitals. There's just about a million that we could list off. And to take it one step further, studies have shown that most people know the word for penis and can accurately identify one. But on the other hand, many people don't know the word vagina refers to just the passageway from the uterus to the outside, and that the word vulva is the correct term for the external pelvic floor that you actually sit on, that you see, that you would wash in the shower, for example. Without this correct language, it naturally feeds into not talking about this part of your body. And that's what we often see in our society. Our society continues to be so uncomfortable with subjects related to our pelvic health. Women, especially, are not empowered with this knowledge about their pelvic floor and its functioning, which can lead to not only discomfort and fear surrounding this part of the body, but also not getting the proper care for their health overall. So that's why we are so happy that you're here this afternoon to learn for yourself or maybe a loved one, to help us break the shame and taboo around the pelvis, the pelvic floor, and the genitals, and to reclaim this part of your body as good and an important part of the whole. If you're unfamiliar with vaginismus, or if you or someone you know is dealing with this condition, this event aims to shed light on what vaginismus is, why it occurs, and how a holistic approach with pelvic floor physical therapy and counseling can be an effective treatment. So these are just some of the talking points that we will cover. So before I go over the definition of vaginismus, it's important for you to know what your pelvic floor muscles are as we're talking about them. So when I am talking about, thank you, your pelvic floor muscles, what I'm really talking about is the group of muscles, ligaments, fascia, and connective tissue, nerves, and more that lie between your legs where a bathing suit would normally cover. So I have the pelvic floor model here. Although there's also arteries and veins and nerves and a lot of lymphatics in this area, we mainly refer to the pelvic floor as a group of muscles that attach from the pubic bone in the front to the tailbone in the back. And then from the ischial tuberosities or your sit bones on either side that kind of make up this hammock of tissue known as your pelvic floor muscles. Vaginismus is the term used to describe involuntary and often painful spasming or clenching of the muscles of these pelvic floor muscles, particularly around the vaginal opening during any attempted penetration or anticipation of penetration, such as with inserting a tampon, undergoing a gynecological exam, or engaging in vaginal intercourse. The sensation can be likened to hitting a wall and is often accompanied by significant pain as people might try to push through the muscle contraction and tightness. The intensity of pain can vary and can be a sensation of stinging, burning, sharp pain. This is often accompanied by increased tension of the pelvic floor muscles, sometimes referred to as hypertonic or overactive pelvic floor. However, what we also see can go beyond this. For example, if we're just palpating or kind of touching externally around that vulvar region, the muscles can also seize up as a response to just the external touch in that area. That's a big difference between vaginismus as overall pain and muscle spasms with any stimulus in that area versus another medical term you may have heard called dyspareunia, which is painful intercourse. There's superficial dyspareunia or there's deep dyspareunia. So that could mean you have pain with initial entry of penetration or you have pain with more deep penetration. You could have a combination of the two, or you can have just one or the other. We have people come in with these diagnoses all the time. And for us, we really don't need to put a name or a diagnosis to it because we're going to treat what's in front of us. We usually say we treat the person, not the diagnosis. All right, I'm going to move on. Okay, so next I'm going to go over some common causes and contributions of vaginismus. So vaginismus can manifest from the very first attempt at insertion. We call this primary vaginismus, or it can develop later in life. We call this secondary vaginismus. So that's when pain with penetration is new and did not used to be an issue. We have some psychological factors at play. And just to be clear, we hate it if somebody is told it's all in your head because it most definitely is not all in your head. But anxiety, fear, and trauma, for example, can be contributing factors to vaginismus. As mentioned before, those with vaginismus can often come in saying, like, we tried and it feels like we're hitting a brick wall and it hurts really bad. I like to explain that these pelvic floor muscles, particularly the superficial muscles of the pelvic floor, are what we call anticipatory muscles, where part of their job in connection with the nervous system is to protect. So if there's something that the nervous system perceives as a threat, particularly if penetration was painful in the past, then those muscles are going to guard up to try to protect you. So getting this first piece of understanding about our body and developing this mind body connection along with awareness of the nervous system is hugely important. This is also where addressing the mental health component and ensuring we have mental health therapists and counselors on board for support is vital. We also have physical contributors too. So this can be triggered by pelvic floor injury or trauma that can set off this involuntary muscle guarding response. You can kind of think about like scar tissue from a vaginal delivery or surgery. There can be hormonal changes such as in menopause, infections, bacterial vaginosis. So it may be a symptom of something bigger going on. These are all components that we are taking into consideration. Obviously, there's a lot more, but these are just some common examples to keep the talk streamlined. It only takes one time of having painful penetration or painful intercourse, painful attempted penetration for the body to be on guard if there's anticipation of the next time being painful. There is such a nervous system component to this, regardless of the cause or contributing factors, where yes, it is a beautiful thing that your body is trying to give you this information and give you a heads up and saying, like, hey, remember last time this was painful? Maybe we need to do something different. And we are here as providers to help guide you or your loved one through unraveling this process for them. Working with patients through these symptoms and diagnosis is truly such an honor because generally outcomes are very positive and we make huge improvements and impact on quality of life, which, as you can imagine, is really powerful, as well as just helping to improve that relationship with connecting to your body and understanding how these processes work. So, while there is no single explanation for why vaginismus occurs, it is understood to be a complex interplay of physical, emotional, and psychological factors. You can see here in this fear, tension, pain cycle, kind of illustrating what I was describing previously. So, just to reiterate, initially the body may react to penetration with pain, and subsequently it anticipates discomfort, causing the muscles to tighten protectively. This cycle can perpetuate the condition as the anticipation of pain leads to further clenching and spasms. Vaginismus can then understandably lead to feelings of inadequacy, depression, anxiety, and feeling broken or incomplete, which then naturally feeds into this cycle. Please know that if you are dealing with this or someone you know is dealing with this, you or they are not broken, you are not incomplete, and despite its complexity, the condition is actually not that uncommon, and most importantly, it is treatable. One other big takeaway from today is to know that things that are an inconvenience now are not necessarily going to get better on their own. So, especially when it comes to your pelvic floor and your pelvic health, this is not a case where you're just going to grow out of things. Issues that arise just magnify typically as you get older and can get worse as they evolve. Also, know that pelvic floor muscles play a crucial role outside of just sexual function. There's sphincteric function that help hold poop, pee, and gas in until you're ready to release. Supportive function helps hold everything that's above it, and also functioning as a trunk stabilizer, working closely with your deep core, your back, your diaphragm, for example. I don't have time to go into all of this in detail, but just know that if muscles are too tight over a long period of time, such as with what we see in vaginismus, then they are not healthy due to what we call local ischemia or just restriction of blood flow. Outside of pain with penetrative activities, pelvic floor tension can also manifest as bowel and bladder issues like urgency, frequency, retention, constipation, and leakage that might get worse over time if the pelvic floor dysfunction isn't addressed. So, any work that you do to understand how your pelvic floor functions now and to set up healthy habits now will greatly affect how well your body navigates through vaginismus, as well as benefit your overall health and longevity. And one thing we really like to remind everyone is that you are worthy of beautiful and pain free intimacy, feeling safe with pelvic exams, and confident in using tampons or other tools to support your pelvic health. If you feel like you've been dismissed when describing your symptoms of pain, you are not alone and it is not in your head. And you do not have to wait to have a diagnosis before seeing a pelvic floor physical therapist. I believe that everyone can benefit from working with a pelvic PT. Even just one visit can confirm that you're doing well and give you some ideas for moving forward and give you just some opportunities and knowledge of what your body needs. I encourage you not to wait until you start experiencing symptoms because preventing issues is always much easier than fixing them once they've advanced to a point where you've noticed them. But just know that no matter when you come in for pelvic floor PT, you're definitely changing the future course of your health for the better. All right, so just rounding out my part here, how can vaginismus be treated? So, treating vaginismus effectively requires a holistic approach that combines pelvic floor physical therapy with emotional and psychological support, education on your body, relaxation techniques, and lifestyle changes. We really need a whole mind body integrated approach with this. So, first, we would do a thorough pelvic floor assessment. So, what does that look like? It takes place in a private treatment room, just us, and you do always have the option for a second person if you'd like. We would discuss your concerns, exploring your history to identify when symptoms began. At Renew, we really prioritize taking our time with you, recognizing that these discussions can be challenging to unpack. Factors like purity culture we encounter, for example, can often exacerbate this disconnection from the body and reinforce negative attitudes toward sexuality, which may contribute to conditions like this. It's essential to acknowledge and honor these emotions that might come up, where this might be the first time you're really learning and talking about this part of your body. This is also where it's very important for us to start providing education about what your pelvic floor is and its role in your experience, and ensuring that you feel supported, safe, and not rushed through this process. So we assess the whole body here at Renew. An initial evaluation for a pelvic floor patient might actually look a whole lot like an initial evaluation for a hip or a back problem, where we are looking at your hip and your back range of motion, your strength of the lower extremities, checking all the muscles on the outside, looking at your breathing. And then, if indicated, and with the patient's wholehearted consent, we would do an internal assessment. We have a comfortable exam table, no speculum, no cold stirrups. We prioritize your comfort. Our practice is a very consent based, so we never assume that you are wanting or you are ready to do an internal exam. You always consent to that, and you can change your mind at any time. Based on these results of your evaluation, we would then create a tailored treatment plan for you. So, in general, these are some of the things that I might suggest for someone coming in with vaginismus. So, relaxation techniques. We don't treat vaginismus like we would treat a sprained ankle, where we would do soft tissue work and like give you exercises. We really need to integrate practices to recognize the nervous system's role and how you can regulate your own nervous system and learn to recognize your body's own needs. So you are able to get in a relaxed, what we call parasympathetic state, which is what we need to relax your pelvic floor. We have to be able to practice good nervous system hygiene to address this kind of dysfunction and to start breaking that cycle of clenching up of the muscles and having lack of control of those muscles and just getting stuck in that fear, pain, tension cycle. So we teach things such as deep diaphragmatic breathing and mindfulness techniques to down-regulate and soothe the nervous system. For instance, we love hourly check-ins and diaphragmatic breathing as wonderful places to start. So you might think about taking 2 deep breaths every hour. These practices are designed to reduce your overall tension and anxiety and stress, helping you to get into that parasympathetic state. So these are all key things to address because those are factors that exacerbate vaginismus as well as pain. And then also that deep breathing helps to calm the mind and foster a more conducive environment for healing. Also, we want to teach you how to relax other areas of your body that are also connected to your pelvic floor. So, one example we love to address is your jaw. Your jaw is closely associated with your pelvic floor. You kind of have like opposite ends of the same tube and what we call frontal fascial lines from the jaw, the abdomen, and the pelvic floor that all influence each other. So, when there's tension in one, like if you're clenching your jaw or sucking in your belly, then it's going to influence tension in your pelvic floor. So other tips: don't suck in your belly, keep your belly nice and relaxed. Jaw relaxed posture we teach, which is tongue at the roof of your mouth, teeth slightly apart and lips together, practicing that in addition to just checking in with your body and taking those 2 deep breaths every hour. Other important things we go over are pelvic floor stretches. There's a lot of kind of yoga poses you can think about that are great for helping to relax your pelvic floor. These would be like happy baby, figure 4 stretch, butterfly, child's pose as examples. But most importantly, it's not just going through the motions of these stretches, it's learning to have intention behind these stretches. That's going to be a key with deepening your connection to your body, learning how to go into a place of kind of curiosity, mindfulness with these poses as you breathe, being able to notice what your pelvic floor is doing. Is it clenched? Is it relaxed? Those are all things that we would teach you how to feel, just seeing how your body is feeling overall. You can also have positive affirmations we love to use, or prayer, or anything that really speaks to you and can help you get into a place where your heart rate can go down as you connect with your body and kind of find a state of peace and calm and safety with where you're at, just to have that more relaxed state of your body. Pelvic floor motor control also listed here. So we need to make sure you can actually properly relax and coordinate your pelvic floor. That can often be very tricky for people to do. A lot of times people can do the contractions, which are called Kegels, but going the other way and being able to relax and lengthen those muscles tends to be the hardest thing for people. So thinking back to taking 2 deep breaths every hour, what I would add to that then, if you're able to properly coordinate your pelvic floor, is take 2 deep breaths every hour with relaxing your pelvic floor, just to start bringing down that baseline of pelvic floor tension and clenching, and create a new baseline where your pelvic floor and your whole body is much more relaxed. All right. Emotional support and counseling also listed. It is important to ensure that your body is able to process and start to recognize these body signals. So, building awareness with what your body is asking from you and then actually doing it. So, loving it, honoring it, and being able to have non judgmental self compassion so that you can fully relax and start to really nurture your own system. Once you can offer self compassion and non judgmental nurturing to yourself, you can start to manage these symptoms in a safe, secure way, both to yourself, your relationship to yourself, and then also in other areas of your life. We're lucky to be hearing a lot more from Dr. Erika today on this subject in a little bit. And then other things I would definitely go over are just potential aids, tools, and other tips. A really common tool you may have heard of is called a dilator. So that's actually pictured here. We have dilators that come in different sizes. We have really small dilators, smaller than my pinky, to much larger ones. This is an intimate rose set. It is silicone, so it's more bendable, softer, gentler to use. Dilators are used to help facilitate what we call gradual exposure to comfortable insertion, supporting a more progressive and less intimidating process with penetration or insertion. You would insert this tool inside vaginally to kind of stretch the muscles to try and get that length and mobility back. This is a great tool to use because you're in control, and it's something that you can do yourself in the comfort and privacy of your own home. It's helpful to have repeated experiences that are not painful at all. This helps your body to rebuild its confidence and trust that it is possible to engage those tissues in a pain-free way. To this end, it is very important to make sure that if you're using these tools, you're not pushing yourself to pain. That is, we want to keep a non-threatening experience and break out of that pain, fear, tension cycle. So that is just an important thing. We would educate you on these tools in detail in your sessions here, and just make sure you feel really comfortable and confident about using them. Another kind of takeaway from today is that this is an absolutely, what we say, use it or lose it situation. Even if you're not having penetrative sex or you're not sexually active, it's still very important to keep mobility in these pelvic floor tissues. This part of your body is meant to be supple, mobile, flexible, and stretchy. So besides just being able to get pelvic exams or pap smears or wellness women's visits, it's really important to make sure you have mobility in these tissues for your lifelong health. Going back to pelvic floor muscle tension, tight muscles are weak muscles, which can lead to a lot of other issues, as mentioned before. And then I actually have a wand here. So a wand is firmer. It has a tapered end, kind of the S curvature. You can use this to work on deeper pelvic floor muscles, even reaching back to like your deep hip rotators. And so we supply all of these tools in the clinic here so you can actually see them and feel them, purchase them privately if needed, and we would help determine what size would be best for you to use and also teach you how to use it so you feel comfortable. Another thing that goes along with this, and I'm almost finished, but lubrication. So with all these tools, you really want to use a quality lubricant. We are super passionate about this. You want to choose one that is glycerin-free, water-based, especially if you're using silicone toys or tools. Also no propylene glycol or parabens or and no fragrance, all those things. We also want pH balanced lubricant. And then another thing to put on your radar is what's called osmolality. So that is the rate at which something is going to give your tissues water or take water away from your tissues. You want on osmolality close to or below 300. Slippery Stuff is what we use clinically here, and Good Clean Love is another brand that has a good osmolality. This is why I avoid brands like KY or Astroglide because their osmolality is like over 1,000. So what that means is it's actually drawing water and moisture out of your tissues. This is important because dry vaginal tissues are more susceptible to micro tears and infections. And it's also going to keep you thinking that you need to keep buying more of their product. So Slippery Stuff has an osmolality of, I think, 25. So if anything, that product is putting more water back into your tissues, which is always great. And Good Clean Love osmolality is very close to the body's too. So I have a whole other list of things to go through, but those are just some examples. Our therapeutic approach often also involves manual therapy techniques to improve your fascial health and relieve muscle tension. We also evaluate and address other aspects of well-being, such as nutrition, stress management, and overall lifestyle factors to really optimize your body's healing process. We really want to be a part of empowering you or your loved one in their healing journey, and just knowing that you deserve to be able to live your best life for the rest of your life and truly embrace feeling whole.